There's one on there that says traction. So I think it's on the second page. The scapula is on the first. So we're going to do the glenohumeral traction first. That one's actually lateral distraction, so you might want to just correct that on there. And that's for just generalized hypomobility. Okay, and so we know when we're doing tractions, how many grades do we have? 3, right? Okay. So at this one, you're at about 90 degrees, just like so. Okay. I'm going to get as close as I can into that joint. I fight with this table, so I'm just going to come down. I kind of cut my hands like this. I let my patient know I'm going to just come right inside there. You okay? Mm-hmm. And then I'm kind of close right here, right? And then I'm just going to come right in here, and I'm just doing a nice little gentle distraction. I'm actually at about a 3 right now. How's that feel?
Fine.
So if I wanted to, I could do a 1, right? 2, and then 3. I'm at that end range. Most of your patients will love this. After I've done other kind of more aggressive things, I might end with something like this, or a generalized traction and inferior traction, which I'll show you in a second, or caudal glide. There's many different terminologies out there. So yours, I think, say like ventral and dorsal and caudal. So caudal is the same as inferior. Ventral is the same as anterior, in our case. Dorsal.
Posterior.
Okay, there you go. How are you feeling with that?
Fine.
Okay, so that's just a lateral distraction. Oftentimes, I promised I wouldn't do this because I won't confuse you, so I just sometimes oscillate after I'm done with them. Just like this. That just kind of facilitates our mechanoreceptors, those type 1, 2 ones, after I've been doing something with the patient. So now, for the inferior traction, and with these you could use a belt, okay? So I think in the beginning I'd like you to use your hands just so you get in close to the joint, but if you are a smaller person or you're not as strong, to save your body, it's totally fine to use a belt, and I can come around and show you guys how to do that. So in this one, she's going to be kind of in the loose pack position, okay, and her elbows bent a little bit. Again, I'm just right here. She's close in to me. I'm just going to kind of come in here, and I'm going to just do an inferior traction. Okay, how's that one feel?
Feels good.
Do you like one better than the other, or are they just different?
This one's more relaxing.
Uh-huh. So this one isn't on there, I don't think.
Shoulder caudal glide.
Yeah, it is.
Is it on there?
But here, the pictures are like,
Yeah.
watch what she's doing here, because he's
Oh,
pulling way
he
down
is
by
like
her
pulling,
elbow.
yeah.
Yeah.
Well, that's Mr. Kaltenborn. He's here.
Yeah.
He's got a belt on her, and he's doing this. He's
Yeah.
got it wrapped around her.
Yeah.
And I always like to be close in. It's just my, yeah. And I just got her in here, and so she feels really safe. When they're like guarding and stuff, and they're like a post-op or something like that, and I just want to try and help them have a little less pain and a little more trust on my side. Okay? So that's that one. You guys okay if we do maybe one more? Before we try? So that's also hypermobility and pain, right? So you're going to do grades what for pain? 1 and 2. The 3 is going to be more for that generalized hypomobility, and then you can end up with a 1 and a 2 to kind of help if you caused a little bit of discomfort. And when we're talking about joint modes for the lower extremity, some of you guys would do a grade 1 or 2, and then you would remeasure or reassess for range of motion. So give me a justification of why you did that. Is it a direct correlation doing a grade 1, 2 to get range of motion?
Because if they decrease pain, then you might be able to move more.
Absolutely. So that's all we're looking for rationale. So if you're going to do a grade 1, 2 for pain, they're going to have less pain, they're going to be able to move better, right? Just like when we get less swelling, we're going to be able to get, but we just need to know it's not a direct correlation, right? So we're not changing that joint's mechanics inside the arthrokinematics by doing a 1 and a 2. We need to get to at least that 3 to do that. So technically, when you were doing your joint mobs, assessing their range of motion, I think, is a very valid, functional thing. But you could also, for time's sake, just reassess their pain on that one. If you were just doing grade 1s and 2s for pain, do your other intervention that you were going to do for range of motion and reassess, just so that you could spend a little bit more time on your clinic exercise and all that. I'm okay either way. You just need to rationalize if you're using those 1s and 2s. Okay? So the last one we're going to do, just because I think we're in a good spot here, is an inferior glide. And so that's going to help with abduction, right?
Didn't you just do the inferior?
Yeah, she did inferior like
Distraction. Distraction. So now we're doing it. So that was the one I told you it's not really on there. Oh, I know, you're going to have to redo it. Man. Okay,
So you
so,
just add inferior glide. I did
Yeah.
the same thing on mine.
yeah, so the inferior glide is actually on there. It was the, traction.
But you're doing it different anyway than the picture, so, which I do it like you do, so.
Yeah,
we're
so
good.
we'll show both ways, but I usually come up here for the inferior glide.
Inferior.
And this is going to help with abduction. So again, to start out with, they're going to be in the loose pack position. So she's just kind of like this, right? I face her feet, which is different than your picture in there. I find her joint line, right, where the glenohumeral joint is. I want to make sure that my line of pressure is going to not come here or here, that it's going in that direction of where my, glenohumeral joint is. I give a little bit of distraction here, right? Because I want a little space, just like we did with the lower extremities, right? So you want to give her a little bit of distraction here. And you're going to be able to know when your therapist isn't doing that, because this isn't going to feel so great. This is going to feel better. Would you agree?
Yes.
So then I'm in here. So this would be my 1s. Here's my 2s. Now I'm going to go to my 3s, right? Those larger amplitude, getting into some resistance. Those 3s are for abduction, right? And then my 4s are here. Okay? So if you guys all want to just take a turn to come around here and see. Okay, so I'm going to give her a little bit of distraction. She's in a loose pack position. I'm palpating at her joint. What I see most of the times is people are down here, so just make sure you're right at the joint. You'll be able to feel that if you give her a little distraction. You'll know exactly where that space is, okay? I'm going to make sure I have a good line of force. I kind of use my body. See how I'm just kind of right here? That would be a 4 down here, right? So I need to know my 4 in order to come up and be able to do my 3 and my 2 and my 1, right? So I have to go down to that end range to know what my 4 is in order to be able to do my 3s, my 2, and my 1. Okay? Everybody get to see that?